We can get started. Good evening, everyone. I'm Anthony Maricola, Manager of Information and Adult Services at the Ferguson Library. And on behalf of the library and Stanford Health, welcome to tonight's program. The Ferguson Library is committed to providing resources and programming that addresses issues impacting the Stanford community, such as those being discussed tonight. Tonight, our panelists will discuss how Stanford Health and the state of Connecticut are making healthcare affordable through a variety of ways for Connecticut households. And for those who may not know, through January 12th, we have Access Health CT on site at our main branch of the library, assisting individuals and families enroll in health insurance. No appointment is necessary, but it is encouraged that those wishing to enroll do so by December 15th to have coverage that begins January 1st. I'd now like to welcome our moderator for the evening, Paul Galino, Vice President, Finance and Managed Care for Stanford Health, who will now introduce our panelists. Thank you for being with us, Paul.
All right. Thank you. Thank you and good evening. My name is Paul Galino. I am the Vice President of Finance and Managed Care here at Stanford Health. I'm pleased to be here with you tonight and our panel to talk about something that affects all of us, the cost of healthcare. I'm going to introduce our panelists, ask them to answer some questions, then afterwards you will be able to ask all of us questions. This discussion's goal is to help you know about some important resources that are available to help you understand healthcare costs. Before we get started, I'd like to let you know that the ability of patients to access healthcare and understand the cost of getting care is very important to Stanford Health. And we are continuously looking for ways to improve affordability while ensuring the best quality care. And here are some of the ways we do this. We provide a substantial amount of free and reduced care. In 2022 alone, that amount was approximately $80 million. We also know that one of the best ways to keep healthcare costs down is to make sure people don't get sick, or if they do, they are diagnosed early through regular checkups and preventive tests like mammograms and colonoscopies. The earlier disease is discovered, the easier it is treated with better outcomes. Said another way, without preventive care, diseases are caught late, interventions cost much more and are much more difficult for the patient, and the outcomes are worse. In light of this, we try to make it as easy as possible to access services like primary care at Stanford Health or community clinics, and we try to get the word out about primary and preventive care like we're doing tonight. We are helping residents understand that their healthcare costs. We're helping residents understand what their healthcare costs will be through a cost estimator. And that's accessible through our website and through a dedicated phone number and a dedicated email address. We'll talk a little bit more about that in a little bit. We provide price transparency on our website of the most common services and items by individual payer. Every hospital does this, so you can compare costs across hospitals. Finally, we educate people about insurance eligibility, including Medicaid, for both our patients and in the community, like building one community. Please know that we work with elected and other government officials, such as Representative Paris, the healthcare advocate, the Office of Health Strategy, and others, on the issue of how insurance costs and practices the drug industries and others might use to lower costs while ensuring quality. Our CEO has been participating on the governor's workshop to lower costs for several years now. Government and all providers all know that it is important and that we can help. Now, I would like to introduce our panelists who will provide a short presentation in the order of their introduction. First, I am very pleased to introduce Attorney Sean King. Attorney King is currently the interim healthcare advocate for the state of Connecticut. Previously, he served for over 8 years as the general counsel for this office, which is a consumer-based government organization in Harvard. Second, I am pleased to introduce my colleague at Stanford Health, Matt Simon. Matt is a director of revenue cycle at Stanford Health and has many years of experience relating to patient billing and insurance issues. Thank you both for participating in tonight's panel. Now I will turn it over to Attorney Sean King the Connecticut Health Advocate.
Thank you, Paul, for that introduction, and thanks again for inviting me to be here. Once again, I'm Sean King. I'm the acting healthcare advocate for the state of Connecticut. Just a little introduction to the Office of the Healthcare Advocate for people who aren't familiar with us. We are a state agency, an independent state agency. We're about 20, going on 24 years old. We were established at the end of 1999 by Public Act 99-284. Originally named the Office of the Managed Care Ombudsman. The original mission was to assist healthcare consumers with managed care plans, dealing with a lot of denials of coverage for healthcare services when your managed care organization would deny a prior authorization for a service, a surgery, a procedure, something like that. We would have a staff of case managers there to assist and to represent consumers through the appeal process when those claims are denied. Our mission has expanded over time, so we continue to provide those services, but we also assist consumers who are looking for health insurance coverage to help them compare different options, point them in the direction of the appropriate health plans, or direct them to Medicare, Medicaid, whatever happens to be the best, most appropriate choice for them, whatever they happen to be eligible for. We're there to help educate consumers once they're enrolled in a health plan about their rights and responsibilities under their health plans. Again, we continue to assist consumers with other disputes, not just prior authorizations or other what they call utilization review processes, but we help them with billing issues. We'll help folks who may be having a billing issue with their provider, whether it's some type of a coding problem, they submitted the claim wrong to their insurance company. We can kind of intervene in that situation and help work things out in between the provider and their health insurer, and try to resolve those issues. Our services are free. Our clients are anybody who resides in the state of Connecticut. In addition to that, we do help some out-of-state folks as well who happen to be enrolled in a plan that is located here in Connecticut. Sometimes it's through an employer, a Connecticut employer, but the individual happens to live in Massachusetts or New York or something like that. We also provide assistance to those folks because their health plan is located here. We assist people with all types of health insurance. So it's not just commercial insurance through an employer, not just insurance through Access Health, but also people who are on Medicare, people who are on Medicaid, even TRICARE, the Veterans Affairs get healthcare that way as well. Our staff, in addition to myself, our staff includes a variety of case managers. We have nurse advocates who are clinically trained and understand some of the medical issues that get involved in some of these healthcare denials. We also have a few other staff attorneys, paralegals, and consumer information representatives on our staff who have a wide variety of expertise and are able to help with just about anything that gets thrown our way. If we can't handle it, we do our best to make sure that we direct people directly to somebody who can be of assistance, whether that's the Department of Social Services, Center for Medicare and Medicaid Services, other organizations that have either advocacy responsibility or regulatory responsibility for a particular health plan. The type of cases that we manage, sometimes they're very short. As I mentioned, we provide a lot of quick advice and consultation for people who have a quick question about how their health plan operates. Maybe have a question about a bill or an explanation of benefits document that they received. We call those coaching cases. Those are short coaching sessions, maybe a phone call or a quick email to somebody, we can answer their question. And then we handle a lot of more complex cases as well. An example would be one of those denials I mentioned earlier. If your health plan says they're not going to pay for a particular service, every consumer has a right to an administrative appeal process to refute that denial, and we're there to represent folks, collect whatever medical records and other documentation is necessary from their providers, from their health plans, from other sources if needed, and prepare written appeals to persuade either the health insurance plan or an independent review organization to overturn that denial so that individual can get covered for the service they're looking for. Just a little bragging about some of our successes over the years. In 2022, we saved healthcare consumers over $6.7 million. Again, that may be just a $100 claim rising up to claims that run 5 or 6 figures, depending on the type of healthcare services or how long they're in the hospital, that type of thing. Since our inception way back in 1999, we've saved consumers over $128 million overall. Just to give you a sense of the volume of work that we do, we had over 4,000 cases opened last year in 2022, still kind of recovering from the pandemic when our case volume was a little low. We're on pace this year to open about 6,200 cases for 2023. So our volume really jumped up this year. Everybody is busy. We're doing our best to keep up with that volume and help as many Connecticut consumers as we can. I can share this again at the end, but just some contact information if anybody wants to get a hold of our office looking for assistance. We have a toll-free number. The easiest way to get a hold of us, 866-466-4446, or you can email us at healthcare.advocate@ct.gov. I'll turn that back over to you, Paul.
Thank you, Treasurer Russell, for those insightful remarks. Our next presenter is Matt Simon. Matt is the Director of Revenue Cycle at Stanford Health.
Thanks, Paul. Very happy to be here. I appreciate all the work with the Stanford Library and putting this together, and looking forward to answering some questions and getting some education out about pricing transparency and all the great initiatives that we're doing at Stanford Health, and very happy to be on a panel with Sean.
Excellent. Thanks, Matt. I'm going to jump in now with some questions. Attorney King, can you please describe common complaints your office hears from Medicare participants? Is there basic advice you would provide concerning traditional Medicare versus Medicare Advantage plans? And what's the difference between these plans? Attorney King,
talking. I think I was just speaking on mute. I apologize.
Yeah, no, that's okay. We could not hear anything that you said, so if you don't mind starting over.
I'll start over. That's fine.
All right, thanks.
Yeah, so one of the most common complaints I think we get in our office from folks who are on Medicare, or a lot of times it's their families who are reaching out to us. A lot of times it deals with an admission to a skilled nursing facility. So one common misconception that people have is that after a senior has a medical event or an injury, ends up in the hospital for a few days, and then gets transferred to a skilled nursing facility to do some longer rehabilitation. A lot of people don't understand that care can be limited in in terms of how long that Medicare is going to let them stay there. They're not always understanding that there are two sort of types of care that are provided in those facilities. One is the rehabilitation care, where the patient's getting physical therapy, occupational therapy, all of those and other skilled nursing services that bring them back to a level of health where they can start to regain or continue to regain their normal function. The other type of care that's provided there is what's called custodial care, And those are services that include things like helping people get dressed and take a shower and do some of what they call activities of daily living. Those types of services are not covered if they're the only services being provided at the skilled nursing facility. So a lot of people find themselves in a situation where, unfortunately, they, because of their illness or their injury, really can't be discharged home by themselves and be expected to function on their own. But unfortunately, Medicare, if all they need are those custodial type services, or they might need some physical therapy, but not on a daily basis. Unfortunately, Medicare stops paying for those services in that situation, and we tend to get a lot of calls from people and their families who feel that a senior just isn't ready to go home from that skilled nursing facility yet. And it's probably true that they're not, but because of the circumstances, because the only care that they need is some intermittent physical therapy beyond what that custodial care that they need help with, Medicare unfortunately doesn't continue to cover the stay in the skilled nursing facility. So that's one of the more typical complaints that we get. We also get a lot of not as often, but frequent complaints about what they call observation services in a hospital. So if a patient is in the hospital, they have to be an inpatient for at least 3 overnights in order for Medicare to cover their stay at a skilled nursing facility afterwards. And sometimes somebody will find themselves in a hospital 3 nights, 4 nights, 5 nights, but designated as observation or technically an outpatient in the hospital. And if they go to a skilled nursing facility after that, Medicare also does not pay in that situation. Those rules aren't necessarily fair, but those are situations that we hear a lot of complaints about. And it's difficult to help those families maneuver around Medicare's fairly strict rules in those circumstances.
Yeah, very
That was-
nuanced, right? Yeah.
So that was your first question.
That was my
you had a
first
second
question.
part to
Yeah.
that,
Then
Paul.
I had a follow-up to that, or a little bit of a different question. Is there, some basic advice you would provide concerning traditional Medicare versus Medicare Advantage plans? I know the open enrollment just closed on the Medicare Advantage plans, and just kind of maybe some of the difference between these plans.
Yeah, the two major differences and that people aren't always aware of, because the Medicare Advantage plans, the insurers have found some good business in Medicare Advantage and market their plans heavily, and don't always provide all the information that somebody might need or want before they decide between a Medicare Advantage plan and original Medicare. One of the big things that some people are surprised by, excuse me, is that Medicare Advantage plans have more limited networks. So where original Medicare, you can see pretty much almost any doctor in the country, over 90% of doctors are participate in Medicare. The Medicare Advantage plans have their own smaller networks. And so you might not be able to see all of the physicians that you normally see on any given network. So really doing your homework and making sure that you research which physicians are covered as in network under those Medicare Advantage plans is important before you sign up. The other thing that catches people off guard is that Medicare Advantage also utilizes more utilization review. So there are a lot of things where if you're on original Medicare, you would just go in, the doctor would decide whether a service was appropriate for you or not. They provide the service. And then if Medicare decided that it was not a medically necessary service, that's a term of art, that would be something that the doctor would have to resolve between them and Medicare. With the Medicare Advantage plan, there's a lot more prior authorization. So they're deciding ahead of time whether or not a service is appropriate. And if they decide it's not appropriate, you may have to call our office or call somebody else or on your own, try to appeal that denial of authorization for that service. So that medical management piece is a lot more heavily present in Medicare Advantage and can also frustrate people when they're trying to get access to healthcare.
Okay, thank you. That was helpful. Next question, Matt, if you don't mind me segueing to you. Can you describe what the No Surprises Act is in the federal price transparency rules at a high level, just for those who may not be familiar with them?
Sure. Yeah, and the No Surprise Act, I think I can start by saying that a lot of my colleagues at other facilities have the opinion that this is probably the most impactful healthcare law since the Affordable Care Act. And I have to agree with them when we think of the intent of what the law is trying to accomplish with the important protections that are put in place for patients. So the No Surprise Act, it's a law that went into effect back in 2022 on January 1st. And at a high level, the intent of the law is to protect patients from surprise medical bills. Now, the law defines a surprise medical bill as an unexpected bill from a healthcare provider or facility. And you see a lot of these surprise bill examples for patients that may use emergency services, where that facility or that provider may unknowingly to them be considered out of network by their insurance. But a few other examples of when receiving a surprise bill could be for patients that are uninsured, meaning they don't have any health insurance coverage at all. So these patients may be scheduled and at the time of their scheduling may receive incomplete or really no communication at all of what their final bill may look like after the scheduled services are rendered. So to protect patients in each of these type of scenarios, the law has a few main requirements that providers must follow. And keeping it at a high level and quickly just kind of calling out a few of the big ones. The first one is to provide those uninsured patients what's called a good faith estimate. So if we use Stanford Health's process as the example, uninsured patients can expect to receive a good faith estimate after being scheduled for a service at the facility, right? The estimate is provided either 3 days after the patient may initially be scheduled. But if the appointment is scheduled within 10 business days, then they can expect to receive that good faith estimate within 24 hours. And what that estimate outlines is the expected charges for the scheduled service. So the good thing about this and why it's helpful in protecting patients is it allows patients to just be more informed and really assist our patients in making better decisions, or at least more informed decisions when it comes to their healthcare. Another big requirement to add is notice and consent. So I know, I mentioned the scenario of patients unknowingly receiving services from out-of-network providers. So notice and consent is another type of notification similar to the good faith estimate. But in these type of notifications, what it's trying to do is assist patients of expected charges, but it's the expected charges for services that are being deemed out of network. So it means that the responsibility is placed on the provider to notify patients that they are considered out of network, and then provide those gross charges to the patients again, so they can make informed healthcare decisions. And I want to do my best in which, you ask, keep this at a high level. So I think I'll just end it to say that Stanford Health has done a lot of work to be compliant with the No Surprise Act. And since we would certainly not expect our patients of being up to date on these type of laws themselves, Stanford does issue disclosures on these protections. So they're not only on the Stanford Health website, but patients can also see the signage posted throughout the facility, along with handouts that each of the clinical areas have as well, to help educate the patients on it.
Thanks, Matt. I know that this is a very complicated topic, right? There's a lot here, and this is really about just making sure patients are informed, right? And know their financial responsibility. So thank you. Next question, if you don't mind me jumping around a little bit, is I'm going to go back to Attorney King. I have a question for you on how do you see healthcare affordability from an equity lens? And can you describe what you see? I know Stanford Health's community health needs assessments regularly show disparate health status of Stanford residents. For example, a higher life expectancy in wealthier neighborhoods. And that we take steps in our health improvement plans to address this. But I'd like to hear what's on your mind with respect to this issue.
Sure, Paul. And thank you for the question. When it comes to health care affordability, the equity piece of it might look just a little bit different than when we're talking about health outcomes. You mentioned that outcomes tend to be a little bit better, or a lot better in some cases, in wealthier communities than in poorer communities. That's probably generally the same as far as affordability. But one thing we do have in Connecticut is a pretty good Medicaid system. So our safety net program, Husky, captures, at least in terms of affording healthcare coverage, captures a lot of people at the lower end of the income scale. So where affordability really becomes more of a problem is in probably some of the lower middle income levels, where people may not qualify for Husky or even qualify for some of the subsidies that are available through Access Health, through the Affordable Care Act, or through even our program in Connecticut that provides some additional subsidies. So if you're not getting that subsidized healthcare, and you have a family, and you're trying to pay for those health insurance premiums, and then on top of that, you might choose a health plan that has a fairly high deductible, and really those high deductibles, unfortunately, end up really kind of punishing sick people, because most people who are on a high deductible plan never meet that deductible in the course of a year. So they're really paying for all of their actual healthcare out of pocket, except for those preventive services that have to be covered by the health plan. But if you're sick, it's not a preventive service. So you're out there, if you're in the hospital, or if you're getting treatment for chronic disease or something like that, and you have to meet a high deductible, you're now subsidizing the health insurance premiums for other people who are on that same health plan. So that's probably the biggest inequity that we see in our office, is having that cost shift in terms of premiums and deductibles, and other cost shares being forced on sicker individuals who don't qualify for those subsidies or for Husky.
Thank you. Thanks, Attorney King. Next question. Again, I'm going to jump to Matt. Matt, what are the common and avoidable issues about health insurance that patients should be aware of? I'm thinking in particular about Medicare Advantage plans and high deductible plans. I know Attorney King just talked about some high deductible plans. If you get a high deductible plan, what should you know about it?
Yeah. So yeah, Sean did a good job just kind of really talking about the high deductible plans, and he made the statement about how they really kind of just hurt sick people, and I have to agree with that. In my role as a director of front end revenue cycle, I'm in a position where I do get to interact a lot with patients and talk to them. And one of the surprises I find, and the biggest issue with insurances, including the Medicare Advantage plans, is how patients are not aware that just because they have health insurance doesn't necessarily mean that they're 100% covered, right? And there's the things such as the high deductibles, co-pays, co-insurances, and whatnot. So really, one thing we're trying to do a lot at Stanford Health to kind of help patients with this is really taking two approaches. So, the first approach is really educating patients on what their benefits are. So you'd be surprised at how many patients don't understand what their deductibles even set at, or if they would have a copay for a particular visit, or the percentage of their coinsurance. So on the Stanford Health website, we have what's called a cost estimator tool. So we are trying to do a good job of really pushing patients out to that cost estimator tool. It allows them to kind of run their own benefits and determine what their patient responsibility would look like for particular services, whether it's an X-ray or another diagnostic imaging or even a surgery to say. So we're definitely just trying to get more information out there, educate the patients. And then the other thing we're doing to kind of get around this issue is we're trying to roll out a much more robust pre-service unit, which means prior to the day of their care, have the conversation with patients on the services that are going to be rendered, go over their benefits, make sure they understand how the benefits can impact them. If they have a deductible, talk through them what that means, discuss options as far as payment plans, financial assistance, and everything like that. But really, it's just trying to get in front of it to do everything to avoid patients having to worry about a surprise bill.
Thank you. I think I'm gonna ask one more question, and it will be for both you, Matt, and for Attorney King as well. One thing that I observe is often people do not know about the fact that there's different care settings and different costs for each. For example, the emergency department is very expensive. A walk-in clinic is somewhat costly too, and not as affordable as a primary care office or a community clinic like Optimus, Family Centers, or AmeriCares, all of which provide wonderful care in this area. And so there are many, in addition, there's also affordable telehealth options. So my question for both of you is, how do we educate people about making sure they go to the right place at the right time to help control healthcare costs? So maybe I'll start with Attorney King.
Sure, and yeah, thank you for that question also, Paul. How to educate people, it's difficult. Health insurance is complicated. That's, our office, we're an entire state agency of a staff of 18 who are here to assist people because health insurance is complicated, because it's hard to understand what your plan does and doesn't pay for. It's hard to understand how to navigate the appeal process when your plan decides not to pay for something. We participate in a lot of different activities and forums to try to educate people, including this presentation here today. We hope that the viewers and listeners today will pick up a few pieces of knowledge that will help them either immediately or down the road to avoid some surprise costs when it comes to getting their health care. Focusing on some of those health insurance 101 type things that Matt mentioned earlier, just making sure that people understand what their deductible is, what the difference is between going in and out of network, what the difference is between certain levels of care. A lot of people do understand even that an emergency room visit might be an expensive option, but they don't really realize how expensive that is until they get that bill. And we do get those complaints sometimes from people who, they broke a finger, or they needed a couple stitches or something like that, and they go to the ER thinking that it's maybe a couple $100 or so that they're going to have to pay, and instead it's somewhere upwards of $2,000, because that is an expensive level of care to go and get those types of services at. And not just understanding those different levels of care, but also who are you getting the care from. Even if it's in network, sometimes if you're going to one of these providers who is part of a large health system, you could be billed twice for the same service, one by the facility itself and then one by the physician for their professional services. And a lot of people get surprised by that sometimes when you know, if you went somewhere else to someplace more independent, you'd only get the one charge, and generally it's not as much as you would face going to a larger health system. So, you know, every day we're trying to educate more and more people on those major issues that are impacting their wallets, and you know, as much as we can have these types of forums and get the word out to the public. That's the best we can do.
Yeah, absolutely. If you are a patient who has, you know, you're on one of these high deductible health plans like we were talking about, and you come into the emergency room, you may not realize that you have other more affordable options to you. You're just accustomed to going to the ER when you feel like you have to be seen right away, and then you could be on hook for a cost that's much higher than if you waited to the next morning to see your primary care physician, or you know, if you utilize like the telehealth options that are becoming more and more consistent out there to the community. So really it's just outreach, education, and not shying away from the conversation, having the conversation as early as you possibly can have it, so this way patients can at least feel at ease knowing what the expectations are going to be, you know, post services, post ER visit. What is my bill going to look like? And then make them better prepared in the future to where maybe they want to use something such as the Stanford Health on-call care and other telehealth options and stuff like that.
Excellent. Thank you both. I know that was an open-ended question, right? And it sounds from both of you that it's really multifactorial, and you know, big thing is around education, making sure people understand what's there. And Matt, I think that's a really good point about asking the question, right? Historically, when it comes to healthcare, we did not ask the financial question. So I think asking that question up front really can, you know, answer. It's better to ask it up front than to get surprised afterwards with the bill. So I think that's really a great point.
Yeah.
I'm gonna pause there. I know we've asked a couple questions, and we've been answering these. So Matt, thank you very much, and Attorney King. I'd like to pause here at this point and see if we have any, and open it up to the audience and see if we have some questions. No questions. I'll wait a little bit. I know there's a lot of information here, and I'd love to say that we answered all the questions, but okay. So I guess that we do not have any questions. So I'm going to say thank you to Matt for your participation and your assistance this evening. Thank you to Attorney King as well for your participation. You know I asked some pretty tough questions. You both were very knowledgeable in providing some answers to us, and providing answers to those questions, which I think will be beneficial to everybody. Anthony, I don't know if you're still on. I see that you're muted, but I think that at this point that will conclude our presentation for this evening.
Paul, if I may just jump in.
Sure.
One more time, just to pitch people to come to our office if you have questions about your health plan, and just to piggyback on something that Matt touched on. You know, I think you know, educating people at the point of enrollment about what their health plan can and can't do for them. You know, once you're sick or you're hurt and you're trying to find care, and or even in the middle of an emergency, that's not the time to try to figure out, you know, under that level of stress and urgent crisis to figure out what your costs are going to be. You know, so the more that we can educate people before they need care about what their plans cover and what their costs may or may not be, those types of activities would be best. And in our office, again, we're here to do just that and to help people answer their questions. If you want to get a hold of the Office of the Healthcare Advocate, it's 866-466-4446, or email us at healthcare.advocate@ct.gov.
Thanks, Sean. And again, that concludes our presentation for this evening. Thank you again, and I hope hope everybody has a good night.
Thank you, everyone.
Thank you.
Thank
Thank you,
you.
everybody.
Bye now.